On this episode, we're going to be diving into a very important discussion, which is mental health myths. So for tips and bits on mental health, please do like, comment, and subscribe to this channel. Now, what are myths in mental health? Myths are misconceptions that can cause misunderstanding and stigma when it comes to dealing with mental health issues. On this episode, we will discuss some myths and their truths. Why is this important? Myths can be a source of misunderstanding and stigma. That is why it is important that we bust these myths in order to foster a better environment for persons living with mental health challenges. The first myth says mental health is static. This is false. Mental health is dynamic. Just like our physical health, it fluctuates. Today you might feel all excited and full of energy, and the next minute you might become sad and irritable. Having an understanding of this helps us to adapt to life's changes and challenges, understanding that mental health is a journey and not a destination. So that's myth number 1 busted. Myth number 2 says that mental health challenges are rare. This is also false. Mental health challenges are common. It can affect people of all ages, backgrounds, and walks of life. Another one is that seeking help is a sign of weakness. Seeking help is actually a sign of courage. It actually takes strength to acknowledge when you need support. Therapy and counseling are tools for healing and growth. They are definitely not signs of weakness. Myth number 4 says mental health struggles are always visible. This is a myth that we need to throw to the curbs. Mental health struggles are not always visible. You can find someone looking okay and all cool on the outside and yet struggle internally. We need to always learn to express compassion and empathy because you do not know what the next person sitting by you is dealing with. Another mental health myth is that mental health struggles are rare. The fact is, mental health struggles are common and they can affect people of all ages, backgrounds, and walks of life. Millions of people in the world experience mental health challenges. So if you or somebody you know are having symptoms suggestive of a mental health struggle, please feel free to talk to a therapist. Myth number 6 says that children cannot have mental health struggles. This also is not true. Children and adolescents can experience mental health challenges. Early intervention and support are crucial for their mental well-being. Mental health issues are not a result of personal failure. Myth number 6 says that mental illness is a sign of personal failure. We both know this is not true. They come from a combination of genetic, biological, environmental, and psychological factors. So please, when you meet someone experiencing a mental health challenge, do not say it is the person's fault. Are people with mental illness violent people? This is myth number 7. The fact is, people with mental illnesses are more likely to be victims of violence than perpetrators. Another myth is that medication is the only treatment for mental illnesses. This also is false. Treatment for mental illnesses are usually individualized. While medication is one option, psychotherapy, lifestyle changes, and even social networks are also crucial in helping someone dealing with a mental illness live a fulfilled and a better life. Now, this is an interesting part for me. This myth says mental illness is just a phase. Oh no! Most times, mental health challenges require ongoing support and management for people who are dealing with such issues to be able to optimize living. How about telling people to just snap out of it? Mental health challenges are not just situations that you can ask somebody, please snap out of. You have to be considerate and empathic. Support, understanding, and professional help are always needed. Another mental health myth says only crazy people have mental health challenges. The fact is, mental health issues are not an indication of being crazy, especially in our climb where we feel like that half-naked man on the street is crazy. There are many people who are dealing with mental health challenges and don't look it. Mental health challenges are not indicative of someone being crazy. These are common health challenges that can affect anyone. Addressing mental health myths is important in fostering support, understanding, and care for those living with mental health challenges. If you have specific questions or concerns, please feel free to leave them in the comment section. Now we'll move on to the next myth. This myth says therapy takes forever to show. This also is not a fact. The fact is that many individuals experience positive changes early in therapy. Though the duration varies, therapy can be effective in providing coping strategies and support. The last myth for this episode is that mental health challenges are a spiritual punishment for people who have erred. This certainly is false. Mental health challenges are often considered to be complex and multifaceted. It is often influenced by a combination of biological, environmental, social, and psychological factors. While some individuals might incorporate beliefs and religion into their understanding of mental health challenges, it is important we approach these matters with sensitivity and respect for diverse perspectives. If you are concerned about yourself or someone you know, please feel free to reach out to a mental health professional or a healthcare provider. You can also drop your questions in the comment section of this episode. Don't also forget to subscribe, like, and share with loved ones. And as a parting shot, please note that early intervention and support can increase the chances of successfully recovering from a mental health condition.